Welcome. Today we will be talking about social isolation and loneliness. This is a huge problem, especially with our older adult population. Our focus today will be on the role of occupational therapy in combating this issue. I will also list additional resources and strategies that you can provide to your clients as well. My name is Anna Nguyen, and let's get started. Loneliness and social isolation, though they do sound similar, actually have a distinction. Loneliness is the feeling of being alone or separated regardless of the amount of social contact, whereas social isolation is the lack of social connection. So you can see that social isolation can lead to loneliness. That is one way they are connected. However, people can be lonely without being socially isolated. So, who is specifically at risk? The CDC identifies four specific populations, including number one, immigrants, number two, members of the LGBTQ community, number three, victims of elder abuse, and number four, older adults. Our focus today in this video is on our older population as they are the most at risk. Many may very well check multiple points off this list as well. Here are a couple statistics just so you can see how bad it really is. Social isolation in general is associated with about a 50% increased risk of dementia and other serious medical conditions. Approximately 1/4 of community dwelling Americans aged 65 and older are considered to be socially isolated, and a significant proportion of adults in the US report feeling lonely. People who are 50 years of age or older are more likely to experience many of the risk factors that can cause or exacerbate social isolation and loneliness. This is living alone, the loss of family members and friends, chronic illness, and sensory impairments. This presents a major risk for premature mortality, comparable to other factors such as high blood pressure, smoking, and obesity. It's pretty high up there. Poor social relationships, characterized by social isolation or loneliness, was associated with a 29% increased risk for heart disease and a 32% increased risk for stroke. Loneliness among heart failure patients was associated with a nearly 4 times increased risk of death, 68% increased risk of hospitalization, and 57% increased risk of emergency department visits. With all of this said, hopefully you can understand that the severity of social isolation and loneliness is a very big problem that we have right now. This places occupational therapy in a very unique position to make meaningful and significant contributions to this area. One of our main roles is to promote social and leisure engagement within their daily routines. As we know, participation in these activities is critical to your health and well-being. Especially active participation with activities that require cognitive, physical, intellectual, and social skills have actually been identified to decrease cognitive decline and promote physical health within our clients. It is also important to note that us as practitioners should identify loneliness and social isolation within our patients, as many of them are at risk. We have the ability to prevent medical conditions associated with loneliness and can use assessments such as the Berkman-Syme Social Network Index to measure social isolation or the 3-item UCLA loneliness scale to measure loneliness. Our second role as OTs is to provide resources and create an inclusive social environment within each practice setting and individual treatment. This is important because we may assume that because activities are set up within a skilled nursing facility doesn't mean it truly caters to the needs of our clients. A study by Fidanza et al. 2020 analyzed the level of social participation among older adults within an assisted living facility. Participants actually reported a lack of assisted living facility provided social supports upon moving in. It resulted in a lot of feelings of loneliness and seclusion. They were dismayed to discover a disconnect between social expectations from being in this facility and reality. Even group activities were not viewed or structured as sources of socialization. So these observed resident interactions were seen as very superficial in this study. And despite the challenges to social participation, there were some motivated residents that developed their own social adaptation strategies, and they would initiate attempts to develop relationships on their own. Thus, it is very important for us as OTs, if we are entering a facility like this, to make sure the activities that are set up and the interactions that are set up are actually catered to our clients' needs. Our third point is to develop community programs to increase socialization and connection. In a study by Garabrandt in 2019, they found that social isolation actually had a significant negative correlation with engagement in meaningful activities. It also had a correlation to limited visitors. So, one things that are important is that OTs can determine ways to increase participation and increase meaningfulness within the activities. OT should also provide services to adults to include home modifications or task modifications that can even increase further that meaningful participation. And a lot of times we can also think of additional ways that are specific to the client and unique to the client to decrease their loneliness and social isolation. In terms of intervention, you can address this on an individual, interpersonal, or organizational level. Individual meaning right with you and the client, what factors are specifically barriers to them and their social participation. On an interpersonal level, how are they actually interacting with another person? An organizational level, that could be something that it's with the clients, but it can also be with the institution itself. Especially if you think of community setting, one of your best interventions is overall education and awareness. That can be for both the staff and community members. Just knowing what your at-risk signs are. Is your client living alone? Or are they a caregiver? Are they struggling with money? Have they just had a major loss in their life? These are indicators for social isolation as well. In a study by Smallfield and Malter in 2018, they've discussed some very effective evidence-based intervention approaches for both social participation and leisure engagement. As you can see on this slide, community-based group interventions, community mentoring, and electronic gaming were actually found to be very effective. In terms of leisure, just the education on leisure competence as well as those other activities were found to be very useful. And especially as us as OTs, we do always focus on the self-management, that goal setting, that peer support. But one that is less noticed of is engagement in meaningful work. And that can be something where it's volunteering, but also civic engagement. There are opportunities such as Respectability, an initiative by the National Council on Aging that partners mature adults in these roles as professional volunteers for nonprofit and business corporations. By engaging in tasks that benefit the community, this connects our patients to a bigger purpose that helps them combat those internal feelings of loneliness. So I urge you to encourage your clients to change it up. Here is a list of a couple of tangible ideas that you can get your client to be doing today. In addition, here are some resources that you can use or share with your client. Go ahead and just pause the video and you can just screenshot and you should be able to get the contact information. And if you are an older adult and you are trying to find some help, please speak up. You can find your local senior community center or public library, and somebody should be able to help you there. Or you can go online, ask questions on forums like Iris OC that are meant to be easy to navigate. You can also hire a case manager to help you navigate these resources because there are a lot of them. Make sure you can also just talk to your doctor insurance, and they will point you to referrals and the right resources for you. I encourage you to check out the Heart to Heart OC Senior Center Conference this year as well. It's virtual hybrid and we'll be talking about these same issues. In conclusion, I'd like to sum it up and leave you with a message to live with purpose. Because when we engage in activities that are meaningful to us, they become a necessary part of our lives. We find a purpose bigger than ourselves and realize that we truly are not alone. Thank you so much for joining me today. Here are a couple of the references. I hope to hear from you soon. Bye-bye.